Hi, I'm Matt Melvin. I'm an educator with American Ambulance, and today we're going to be going over airway management. When you start your airway management station, you'll want to make sure you have your O2 tank, a BVM, a lateral suction unit or portable suction unit, a dummy, and this is your OPA, and this is your NPA. Once you've assessed your patient for responsiveness, found out that they are unresponsive, but they do have a pulse, they are still having a breathing problem, you'll want to make sure you open the airway. There's two ways to open the airway. The first is with a head tilt chin lift. That is used for any non-traumatic patients where you want to open the airway. If you want to open the airway in a traumatic patient, you want to make sure you get your hands behind the angle of the jaw, push on the zygomatic process, and pull the jaw open. This way you're protecting the C-spine, but you're still opening the airway and pulling the tongue off of the back of the throat. Now that I've done that, I'm going to go ahead and start my lateral suction unit. You'll pull out the rigid catheter, and there's a hole in the rigid catheter. You will want to insert it with your finger off of the hole to the back of the throat. Then you'll cover the hole as you suction side to side on the way out. Do this for no longer than 15 seconds. After you've clearly suctioned the obstruction out of the airway, you'll want to insert one of your airways, either an OPA or an NPA. We'll start with the NPA. The NPA has a bevel. The bevel always faces the septum. You want to make sure you size it. Go from the corner of the nostril to the tragus of the ear on the side that you're going to use it on. Always place it with the bevel facing towards the septum and slide it into place. Now if there's an obstruction on this side, you can go on the other side, but you want to make sure you keep the bevel facing towards the septum, and you'll have to turn it halfway down. Once that is into place, you can grab your BVM. Make sure you pull up on the jaw and make sure that the air is going in. Now, if this is still obstructed, you may use an OPA. The OPA can go in two different ways. It can either go in at 180 degrees, completely upside down, or 90 degrees to the side. You go ahead and place it in, and then turn it once it's about halfway in there. It'll fall into place. If you were to place it in straight, you may push the tongue to the back of the throat and cause further obstruction. So we always go either 180 or 90 degrees. And then once again, we will be bagging once the airway is in place. Now with your bagging method, if the patient is unconscious and there's CPR going on, once the compressor gets to 30, you will give 2 breaths. Now with this patient, he has a pulse. So we're going to give a breath every 6 seconds, every 5 to 6 seconds. So you can count 1, 2, 3, 4, 5, breathe. 1, 2, 3, 4, 5, breathe. And you'll continue to do this until either they get an advanced airway or they get to another provider where they can take over the respiration for you.